Good afternoon. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 707 new cases of COVID-19. This brings our statewide total to 58,698 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. This includes 4,066 positive cases in healthcare workers, and it includes 12,408 positive cases among residents of 543 long-term care living facilities, which include nursing homes and personal care homes. Tragically, our statewide total of patients who have tested positive for COVID-19 who have passed away is now 3,943. To date, all of our deaths have been in adult patients. Yesterday, Pennsylvania received our first shipment of remdesivir from the federal government. This medication is used to treat patients with COVID-19. We received 1,200 doses of this medication to treat patients in hospitals who have COVID-19. And by this morning, 51 hospitals across Pennsylvania have received this medication. The hospitals that received the first shipments were selected based upon their numbers of COVID-19 patients over a recent 7-day period and the severity of the illness of those patients. We continue to work to give our hospitals all the tools that we possibly can to treat patients with COVID-19. Now, the supply of this medication is being managed by the Department of Health and Human Services in the federal government. And they have assured us that we will be receiving more of this medication on a weekly basis over the next number of weeks. I do want to caution that remdesivir is not a cure for COVID-19. It is not given in pill form. It's given in intravenous form to severely ill patients that are in the hospital. There is limited information on the safety and effectiveness of this medication to treat people in the hospital with COVID-19. However, it has been shown in a recent clinical trial to shorten the recovery time in some people, which is why the Food and Drug Administration, the FDA, has authorized the emergency use of this medication for treatment of severely ill patients with COVID-19. Remdesivir is given to a patient via intravenous fluids and is given once a day, and there are two regimens. One is a 5-day course, which includes actually 6 doses, and then there's a 10-day course for even more severely ill patients, which involves 11 doses. And it depends on how critically ill the patient is. According to the FDA, the medication may decrease the amount of coronavirus in the body, which helps you get better faster. We will continue to provide as many tools as we possibly can to help our healthcare providers to battle this dangerous virus, COVID-19. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time that it takes to sing Happy Birthday twice. Use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands, and please don't touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come into contact with others. If you live in an area that has turned from red to yellow, please continue to practice social distancing when out in public and make sure you are wearing a mask to protect yourself and those around you. Remember, my mask protects you, your mask protects me, and if we're all wearing a mask, then the community itself is protected. If you have questions about your health, please contact your healthcare provider. If you need mental health resources because you or someone you know is having a mental health crisis, please contact the crisis text line by texting PA to 741-741, or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. If you are struggling with an addiction and need help during this unpredictable time, please call the Get Help hotline, which is at 1-800-662-HELP, or in other words, 1-800-662-4357. Again, 1-800-662-4357. And for the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. Our first question is from KYW Radio. What is the latest information in Pennsylvania on the inflammatory syndrome in children related to COVID-19?
So there is a recently described syndrome in children who have, most of whom have tested positive for COVID-19. These reports are coming from New York City. This is an inflammatory condition of the blood vessels. It resembles other conditions that have been reported in children called toxic shock syndrome, or another one called Kawasaki's disease. So it's sort of an atypical Kawasaki's disease. And these children are very ill, often requiring intensive care and sometimes fluid support and even the use of a ventilator or breathing machine. Tragically, there have been a number of deaths in New York City. We have asked actually hospitals to report any cases of this syndrome to us, but to date we have not received any reports, but we are actually specifically reaching out to our 6 children's hospitals to find out more information if they have any of those cases.
This question is from Fox 56. Luzerne and Carbon counties are reaching out to Governor Wolf's administration to see if they can transition into the yellow phase. Would the state consider transitioning both of them into this phase before June 4th?
Well, we are looking at all of our data over the next 2 days. So we're going to be looking at all of our metrics, other types of data and data reports that we have, as well as the modeling specifically from Carnegie Mellon University. Other models as well. We have models from the University of Pittsburgh School of Public Health, from the Children's Hospital of Philadelphia Data Lab. We have a new model from Wharton, the business school at Penn. Of course, there's the model from the University of Washington that is used frequently in Washington, D.C. So lots of different modeling that we're looking at, and then we will make our recommendations to the governor about what counties might go from red to yellow, and the governor will make his decision.
From the Pocono Record. How will collecting information on gender identity and sexual orientation help in the fight against COVID-19?
Well, we want to collect as much demographic information as possible about patients and about populations that have COVID-19. So we have discussed before that we, through our NED system, our data system, are looking for data on race and ethnicity. We're doing somewhat better getting that data. We've had challenges in terms of the reporting, but we are adding to that reporting sexual orientation and gender identity to the NED system. So we would like as much data as possible about all the demographics of patients who have this disease.
As a follow-up, is there any concern that this information could be compromised, putting Pennsylvania residents at risk of persecution?
No, our NEDS data system is completely confidential within the Department of Health and the agencies that we work with.
From WPXI, what are the dangers of PPE litter? How important is it for people to properly dispose of PPE, especially as we move to the yellow phase and see more people out and about?
Well, so we have to describe what we mean as PPE at the Department of Health and what other people are describing. So what we mean as personal protective equipment is the type of equipment that we send to healthcare providers, that we might send to hospitals or long-term care living facilities or to EMTs and ambulance, et cetera. And so that would be the N95 masks. That would be surgical masks and surgical gowns and gloves. Of course, if those healthcare providers are in contact with patients that might have COVID-19, then those materials need to be disposed of in the red biological waste bags, and then disposed of the way all biological waste from hospitals is disposed of. Because if they were in contact with patients with COVID-19, then there might be active virus for a time. time on those materials. What the public often means are the masks that we're talking about wearing in public, like these type of masks. Now, for cloth masks, we really recommend that you wash them every day, because if you're out and about, we want you to, when you take them off, to use hand sanitizer or wash your hands, and then wash those masks every day. If you're using disposable masks, then when you take them off, please dispose of them. It doesn't need to be the red biological containers, but put them in the garbage, and then please wash your hands.
The Republican Herald would like to know your thoughts on Schuylkill County backing off from its self-declaration of yellow status. What communications occurred with the county, and what will happen now?
So I would leave those discussions to the governor and the governor's office.
Do you think the governor went too far in calling county officials cowardly in his statement?
No, I, of course, support the governor and the governor's statements.
WKOK would like you to please explain the role of plasma in the treatment of COVID-19.
Well, so there are studies that show that plasma, which is part of blood, and it's the part of blood that contains white blood cells and other immune factors, from patients who have recovered from COVID-19, can be, after being processed by blood banks, can be used to treat severely ill patients with COVID-19. So those type of plasma transfusions is one of our arsenal and our toolbox in order to treat severely ill hospitalized patients with COVID-19.
Another question from WKOK. This week you called for testing in all Pennsylvania nursing homes. Can you give us more specific targets for who gets tested, how often the tests are administered, and when we will have the testing capacity to accomplish this? So
yes, we have called for the testing of all the patients and all the staff in these long-term care living facilities, such as nursing home, personal care homes, and assisted living facilities. So we want all the staff and all the patients to be tested. Of course, if you test once, that's not conclusive, because you could be negative one day and positive another, but the retesting is going to be individualized. And so I was giving some examples a number of days ago, but the testing will need to be individualized to the number of cases in the facility. If there's a facility with no tests, then that will have a certain retest schedule. If it is a facility with just a few cases, then they might have a different schedule than a facility with many, many cases. And so we will be working with them to facilitate the testing and to work with them in terms of a testing schedule. In fact, I heard that our staff will probably be doing a webinar for the facilities and outline all of those different measures. We do have the lab capacity finally now to be able to do that. We started piloting it last week, and we have the capacity to roll that out. We are working on a timeline for the governor in terms of how that will roll out with the many facilities. As I've mentioned, there are approximately 693 nursing homes. There are probably 1,200 or more personal care homes. There are other congregate facilities, and so it will take some time to roll out.
Our next question is from the Philadelphia Inquirer. Today was the deadline that Bucks County officials gave the state to let them know when the county would move into the yellow phase. Did you send them a date for when they moved to yellow? If so, what was it? And if not, do you plan to give them a date?
Well, as I mentioned before, we are looking at all of our data and metrics and models right now, and then we'd be pleased to work with the counties, and the governor's office will work with the counties when we have more information this week.
From WESA. The state's reopening plan says that in order for a region to reopen, there needs to be enough testing available for individuals with symptoms and target populations, such as those at high risk, healthcare personnel, and first responders. How are you defining a high risk in this context?
Well, high risk, vulnerable populations would include those in long-term care living facilities, as we've been discussing. It would include other seniors, 65 and older, particularly those with comorbid medical conditions, and that could include hypertension, especially uncontrolled hypertension, high blood pressure. That could include heart disease, such as congestive heart failure, or lung disease, such as chronic obstructive pulmonary disease. So that's what we mean by high risk.
Also from WESA, The White House's plan for reopening says that states should set up Sentinel Surveillance sites to screen for asymptomatic cases. What are Sentinel Surveillance sites, and where are they located in Pennsylvania?
So a Sentinel surveillance site would be a site, perhaps something like the mass testing sites that we have done in Montgomery County, in Luzerne County. Those are still going on, and then the previous one in Philadelphia. But they would be screening asymptomatic people. There's a lot of different ways to do surveillance, and we are working on that. We actually do not have the lab capacity to do that now. We have the lab capacity to be able to do the type of testing that I mentioned before, including long-term care living facilities like nursing homes. And in terms of that population-based surveillance testing, we will need to continue to increase our lab capacity to do that. What would be best to be able to do that would to have a rapid, simple point-of-care test that perhaps healthcare providers could rapidly do in 15 or 20 minutes, maybe even a home test that could be done that had very good accuracy, called sensitivity and specificity. That's not available yet, but I know that there are laboratories and companies working on that. That would aid that type of population-based screening greatly.
From the press enterprise, Columbia County's commissioners declared that they would move their county to the yellow phase on May 15th if the governor hasn't declared by then that the county will move to yellow on May 22nd. Do the county's numbers support their move? Are there concerns you have specifically about Columbia County?
Well, we are looking, as I mentioned, all that data now, and we'll be making our determinations and our recommendations to the governor presently.
From WESA, a lot of our listeners and readers are feeling uncomfortable with Allegheny County moving to the yellow phase and are asking for specific justification for why it is time. What information can you provide to make people's concerns evaporate?
Well, we feel very comfortable with Allegheny County moving from the red to the yellow phase in terms of the number of cases they've had, the rate of change of their cases, the different metrics that we look at, and the modeling that I've discussed before. And so looking at all of that information, we did determine last week and announced last Friday that coming this Friday, in 2 days, Allegheny County, as well as other southwestern counties, can go from red to yellow. We also have discussed all of this extensively with the health commissioner of Allegheny County, Dr. Bogan. We speak with her regularly. She's doing an excellent job, and we all feel very comfortable with this. But we will all need to be vigilant as any county goes from red to yellow to watch, to make sure there's enough testing, to make sure there's contact tracing, and I know Dr. Bogan has set that up in her county, and to make sure that we are watching for any type of clusters that could lead to an outbreak and more cases.
Also from WESA, is broad surveillance level testing a goal in Pennsylvania? If so, what will it take to get there, and when might it become available? So
I mentioned this just a couple questions ago, is that it is an aspirational goal to be able to do broad population-based surveillance testing. We will need more testing capacity to do that, and what would be most effective, again, is if we had a rapid point-of-care test that was very accurate and very sensitive and specific, that could be done very easily either by a healthcare provider or perhaps a mass testing site or in the home, and we could have the results within 20, 30 minutes.
CBS 21 would like to know if youth or high school sports would be allowed to hold practices and games once counties enter the green phase of the reopening plan.
Well, a goal is that in the green phase that would be possible. Now, we have not set the exact criteria for counties to go from yellow to green. Again, it's only been about 5 days that any counties have gone from red to yellow, but we will be setting those, and that would be a goal. Of course, we still need to be vigilant and to be careful. We still need to make sure that we're washing hands and are protecting ourselves from this dangerous virus.
From public source, school districts are already weighing their back-to-school options. Does the state anticipate making a blanket decision on whether schools in the red and yellow zones will be allowed to open, or does the state anticipate leaving that to the schools? And what criteria might go into decision-making on the return to traditional school?
Well, I know that the Secretary of Education, Secretary Rivera, had a Senate hearing about this a number of days ago, and our goal is that the schools will be able to open in the fall. We'll need to make sure that in terms of all the different metrics and models that we look at, that would be safe to do, and I'm sure that PDE would be having discussions with all of the school districts in terms of that reopening.
From the Daily Press, would you please review what a probable case of COVID-19 means? Additionally, if someone is believed to be a probable case, why are they not being tested to confirm whether or not they have COVID-19? If they are tested, does the state continue to include their probable case number in the zip code data, or does that number shift to the positive or negative category depending upon the test result?
So a probable case is someone who might live in a household where there are other confirmed cases of COVID-19. They have symptoms consistent with COVID-19, and so we have considered that probably a probable case of COVID-19. Again, before, when limited lab capacity, then we needed to prioritize lab capacity, and we were not recommending that those patients would be tested. Right now, we'd be very pleased if anybody with symptoms of COVID-19 would be tested. I guess a reason why someone might not be is if other members of the family are sick, it might be very hard to come out to a testing site or a doctor's office or the Rite Aid, what we talked about before, if everyone is feeling really ill. If they have positive cases and documented cases, they need to isolate, so it might be hard for that person to come out. But yes, if they did come out and get tested, and they tested positive, then that would then be a confirmed case. If they tested negative, then they're negative.
From WTAE, some high schools have spoken about plans for in-person graduation ceremonies. If they employ social distancing guidelines, will they receive any resistance from the state?
Well, we are not recommending that large gatherings, really in the red zones, of course, or even in the yellow zones. I think that's given how contagious this virus is. If you have a large gathering, even trying to practice social distancing, it's not 100%, and you could potentially transmit this very dangerous virus. So we would not recommend large gatherings such as a large graduation.
Also from WTAE, in Allegheny County, where the population is 1.26 million, 0.12% of the population has been sick, and 0.01% have died. Obviously, any death is tragic, but how do you use or consider these percentages of people impacted when you're looking at the pace of reopening?
So I sometimes find specific data a little bit hard to calculate in my head by standing here at the podium, but we are looking at all sorts of data and metrics. We're looking at the rate of change of that data. We're looking at all of our models in terms of determining which counties would go from red to yellow. And as I mentioned before, looking at all of that and in collaboration with the Allegheny County Health Department, we feel very comfortable about their moving to yellow on Friday.
Also from WTAE, can you tell us about the various restrictions that will be put in place in parks in areas that move into the yellow phase?
So that type of guidance is available on the website for the Department of Conservation and Natural Resources. Our staff have worked with Secretary Dunn and her staff in terms of social distancing guidelines in our fantastic state parks.
And a final one from WTAE. It appears that there will still be some mitigation efforts in place even when areas move into the green phase. Can you tell us what communities might expect when in the green phase and what would happen at that point?
Well, again, we haven't specifically gone over the criteria yet for moving into the green phase. There are some general guidance available on the websites about life in the green zone versus in the yellow zone and, of course, the red zone. Of course, we'll still need to be vigilant in terms of hand washing. I still think it might be useful to wear masks when in public, especially if you're in a setting where lots of other people are. And we're going to have to be vigilant because this virus will not be gone, even when we go into the green zones, and we want to be careful that it doesn't have a resurgence.
From the Philadelphia Inquirer, yesterday you referred to the nursing home testing advisory as a universal testing strategy, but the advisory says nursing homes should consider testing every resident within the limitations of testing supplies. Can you explain the discrepancy And can you say with certainty that there are enough testing supplies to test every Pennsylvania nursing home resident and staff member?
Well, we feel comfortable that there's enough resources to do that. Of course, looking forward, you can't just test once. You have to have, as I mentioned, testing on a certain schedule. It is possible that in the future that there might be further limitations on supplies that we get from the federal government or from the laboratories and companies that make it. So hard to predict the future, and so that's why that type of statement was added.
From both the Lock Haven Express and ABC 27, with the total number of confirmed cases of COVID-19 at 58,698 since the outbreak began, is there a way to distinguish the number of those who have recovered from the virus from the number who are actively infected, since it has an infectious period of about 2 weeks?
So we've been asked that question a lot. It is impossible for us to contact all of those patients to find out when and if they recovered, but there are some statistical and epidemiological techniques that we can use to do that, so we're researching that. We're reaching out to some other states to see how they have calculated that data. I know that that's important to the population, so we're going to work to try to have some estimate of that, hopefully by sometime, probably the end of next week.
From the Altoona Mirror, a state senator today during a hearing said her understanding is that no county will go to green while any county remains red. Is that true?
We have not made that determination at all. In fact, I was on a call with the governor and the leadership of the House and the Senate today, and we discussed that very question. We have not determined that type of criteria at all. In fact, we haven't really determined the criteria to go from yellow to green, because of course it was only 5 days ago that any counties went from red to yellow.
From the Pittsburgh Post-Gazette, can you explain why the state adopted a policy of cohorting at nursing homes? Do you think this contributed to the spread of the disease in nursing homes?
Really depends upon, what we've tried to do is to individualize the recommendations to the people in the nursing home, how many beds they have, how much staff they have, how many positive cases they have, how many rooms they have. And so we have tried to individualize our recommendations given the specific situation for a nursing home at that location.
Also from the Post-Gazette, why didn't the National Guard come to Brighton sooner than it did? Why did the Guard go to 8 other nursing homes first? Well,
so Brighton has been very challenged. We've had other nursing homes that have been very challenged as well. And what the National Guard is doing when they come is it's supplementing staff, and specifically for significant staff shortages. And so at the right time, earlier this week, the National Guard came to Brighton, as well as the installation of our temporary manager. Temporary manager reports to us. They're paid by the Department of Health, and we're working with them now.
From WNEP, since hospitals have beds available, should more nursing home patients who test positive be moved to hospitals so nursing home staff can focus on the rest of their residents?
It really isn't possible to cohort convalescing patients who don't medically need to be in the hospital in a hospital setting, so we were not able to do that.
Also from WNEP, if supermarkets and many big box stores are safe for customers, why can't smaller retail stores open in red counties, even if they operated only with curbside pickup?
Well, what we've tried to do in terms of the businesses is to have essential businesses open. It is essential for people to get food. And so grocery stores have been open. Other smaller food stores have been open. It's essential for people to get medications that they might need. Thus, pharmacies have been open. And then in terms of home repair, it's essential that if something at home breaks, a toilet breaks or whatever, that people be able to go to get the supplies to fix that, and that's why those types of stores were open.
From ABC 27, Secretary, the data suggests that nearly 70% of deaths are in nursing homes, and an even higher percentage is among the elderly. Some think this data should mandate a shift in strategy to more strongly mitigate long-term care facilities and people with dangerous pre-existing conditions, but ease restrictions elsewhere. In the final analysis, shouldn't students in Elk County and other lightly affected areas be in school right now?
Well, so we have been focusing on long-term care living facilities, and we have a new plan and a new testing plan, as I outlined yesterday. But long-term care living facilities has always been one of our focuses, and taking care of that vulnerable population. Of course, those facilities are in the community. The staff go back and forth in terms of their homes and businesses for grocery stores, et cetera, as well as those facilities. But we have been concentrating on that. But as started last week and continuing this week and continuing forward, states that we think are safe will go from red to yellow. They've already gone to red to yellow, including, I believe, in Elk County, and they have gone from red to yellow. The governor did close the schools earlier because of the significant spread of COVID-19.
Penn Live would like to know why Pennsylvania is the only state that prohibits real estate statewide. Every other state is allowing realtors to practice following the CISA and CDC guidelines.
So after discussion with our department, as well as the DCED, the Department of Community and Economic Development, as well as the governor's office, the decision was made as the safest thing to do to protect public health was to not have real estate offices be open.
From News Talk 104.1. Can an employer require an employee to have their temperature checked every day before work? Does the employee have the right to decline?
That's really more of a legal issue, and I'll defer that to the Office of General Counsel.
Also from News Talk 104.1. If a county has only had one case in the past 9 weeks, is that good enough to go green?
Again, we are right now working on which counties go from red to yellow, and we will be starting to focus on which counties might be able to go from yellow to green. Remember, the incubation period of this virus is on average 5 days, but it can be up to 14 days. It's only been about 5 days since any counties went to yellow, so it'd be too soon right now for any county to go to green. But we're going to be looking at that, and then when that determination has been made by the governor, then we'll announce it.
This will be our last question for today from the Times-Tribune. Can you explain whether the administration has any authority to compel nursing homes to implement surveillance testing? And also, does the Department of Health expect long-term care facilities to bear the added cost of doing so?
Well, we're going to be working on the costs. Of course, we have received funding from the federal government specifically for testing, and so that's our plan at this time. Do we have the authority to compel them? Again, it's a little bit more of a legal question. Of course, we regulate and license nursing homes, and the Department of Human Services regulates and licenses personal care homes. So I believe we do, but I don't think we're going to have any specific challenges working with these facilities in terms of rolling out the testing. We don't anticipate that.
Thank you, Secretary. Thank you for your time today. That is all the time we have, and we will be back tomorrow with another briefing.